Dr. Heather Hirsch. Welcome back to my YouTube channel where we discuss all things menopause, perimenopause, and hormone replacement therapy. In this video, we're going to talk about 5 strange symptoms of perimenopause that you may be experiencing. And I want to talk about these because they're actually more common than you may think. And if you know that these are symptoms of perimenopause, it's going to relieve that anxiety that something crazy could be going on. So if you want to learn about the top 5 strange perimenopausal symptoms, stick around. If you don't know me, I'm Dr. Heather Hirsch. I'm a board-certified internist, completed 2-year fellowship at Cleveland Clinic in all things perimenopause, menopause, and HRT in 2016. I've dedicated the last decade of my life just doing midlife women's health. My new book, The Perimenopause Survival Guide, just hit pre-order on Amazon, and I have helped you in any way. Thank you so much for pre-ordering that book and save those receipts because I'm going to have some amazing giveaways. Be sure you also follow me on socials. I'm at Heather Hirsch MD on Instagram and TikTok. I also have a private telemedicine practice, The Collaborative, and I'm going to tell you more about that at the end. Let's get into those strange symptoms. The very first thing on my list is burning mouth, bleeding gums. This is actually very, very common. And the reason it gets missed so much is because women will actually go to their dentist. Now, we need to raise awareness on all things perimenopause, its management, and hormone replacement therapy, because very often dentists, unfortunately, are not trained to understand that when women lose their little sex hormones, estrogen, progesterone, and testosterone, as those decline in perimenopause, you can have symptoms of bleeding gums or pain in your mouth. Women describe this sometimes as a zinging or as a burning or as an ache. Now, we're not actually sure why this happens. It could be because of a change in the pH with the loss of estrogen. It could be due to a change in the vascularity or the vascular dilation and constriction of the vessels in the gums because of the loss of estrogen. But what we do know is that hormone replacement therapy, or using specifically an estrogen, now you need a progesterone if you also have a uterus, has been shown to resolve burning mouth. This is incredible. If more women knew this, they could start talking to each other and really helping to spread the word. So if you feel burning, aching, zinging, it could be, especially if it's happening at the same time as your periods are changing through perimenopause to menopause, a symptom of low estrogen. Now, I want to make sure that you don't miss something else really important, which could be TMJ or grinding of your teeth. Now, how do I know this? I do this. And it might have to do with the way I am not relieving stress in an appropriate manner. But another thing that could happen is a lot of women will develop TMJ or grinding their teeth at night in midlife. Why? It's a stressful freaking time and we're asleep. We don't know that we're doing it. So another thing that you could do is also try a mouth guard. If that helps, it may be not so much the hormones, but maybe that you're grinding your teeth in the middle of the night. Strange symptom number 2 is actually itchy ears. I cannot tell you how many women, as soon as I say this, go, oh my gosh, I can't believe it. I have had that as well. So why does this happen? Well, as we lose estrogen in perimenopause, this actually can lead to a lot of dryness in our skin. And actually, skin is the largest organ in the human body. And what's really covering your ear is a lot of skin, a lot of this dermal epidermal layer. Estrogen helps to keep skin, and is also the skin on your face, to be hydrated. It keeps it moisturized. It also helps with collagen production, especially on the thin areas of your face, like under your eyes and your neck. Now, your ears are also really thin skin. And as we start to lose estrogen, you can get a lot of dryness, which can result in you feeling like your ears are very, very itchy. I've also had women tell me it feels like their inner ears are itchy, and that is also the same thing. It's just the inner ear canal. So what can help? Moisturizing your ears if you haven't ever put moisturizer there. And also sometimes hormone replacement therapy can help. Now, at this point in this video, if you want to know more about the difference between perimenopause to menopause, you're going to want to check out this video here where I really walk you through all things perimenopause. And if you also are thinking, you're mentioning hormone replacement therapy a lot, Dr. Hirsch, I have many, many videos on that, but a good one to start with is this one here. All right, let's get to weird symptom number 3. The unfortunate symptom number 3 is a sensitivity to alcohol, particularly if you never had a sensitivity to alcohol before. A lot of women tell me they simply cannot, if they're having a glass of wine with dinner and they like to enjoy a little bit of alcohol. Obviously, I'm a doctor. I should say, please consume alcohol in moderation or don't drink alcohol at all. But I certainly understand that many a woman loves a glass of wine here and there with her dinner, right? And a lot of my patients will tell me, I cannot drink anymore. I will get hot flashes, night sweats, and flushing. And this is happening at the same time as they're going through perimenopause. So what's happening? Well, your liver is getting really frustrated. And the change of your hormones is causing a slowing in how the liver metabolizes your alcohol. That means that a little bit could get you pretty drunk or have really wide systemic effects that go throughout your body. And a lot of women feel that this is more likely consuming red wine versus other liquors or other wines. So this is actually very common, and it has to do with the changing of the hormones and the liver physiology not being able to basically detox everything through the factory as fast as it used to before. So if this is happening to you, I definitely recommend actually holding off on the alcohol, at least for a while, because if it's going to cause you to toss and turn all night, you're going to get terrible sleep, have terrible mood disruptions, have brain fog, and stubborn weight gain. Alcohol really contains a lot of sugar as well. So if you're battling weight gain or just a changing metabolism through perimenopause, I would say give the alcohol a break. Now, sometimes when we do start hormone therapy, this can help. But again, I am a doctor. It is my job to say, please drink alcohol in moderation and do so safely. The fourth symptom that happens a lot in perimenopause that's relatively unknown or deemed uncommon, but something I hear all the time, is a sensitivity to clothing. Maybe all of a sudden things feel so tight, or that jewelry that you always wear, or the earrings that you always wear are just absolutely irritating you. And you feel like you just want to be naked in a field all the time. The reason this is happening is because there's a change in our histamine response as we go through perimenopause. Now, your histamine response is something that happens particularly, let's say, if you're like me and you have allergies. I have spring allergies, and so that histamine release is really high. It's trying to protect me from, let's say, the pollen, which isn't actually all that dangerous. And with that histamine release causes a lot of vasodilation, runny nose, itching, scratching, and just feeling uncomfortable. Estrogen helps to regulate histamine release and to control it. But as the estrogen starts to decline, those histamines can really get out of whack. And this can just make you feel uncomfortable in your own skin. It can sometimes be why you have new onset of rashes or even skin discolorations or acne sometimes. This can be due to multiple processes, but also the dysregulation in this histamine release. I know. Welcome to perimenopause, but the more you know, the more you know. Now, the last one on the list is actually very common, and it's hard to say if it's specifically related to perimenopause, but I'm gonna tell you, I see it all the time in my women, and it is new onset of healthcare related anxiety, or anxiety related to specifically your body. It really starts to flare in perimenopause. So why could this be? There's actually many reasons. First off, the progesterone is declining, and progesterone helps to release GABA. GABA in the brain is our calming hormone. It makes us feel very calm and chill and happy. And as progesterone is declining, GABA is declining, which can actually lead to insomnia and anxiety, especially at night. Also, perimenopause may be the first time in a while you feel things in your body, an extra heartbeat or heart palpitations, joint aches and pains, brain fog, or even like me, urinary urgency that comes out of nowhere. And all of a sudden you go down the Google rabbit hole. So two things are happening at once. Our bodies are changing and we are losing the calming, protective effects of our natural progesterone. And this can lead to a lot of healthcare related anxiety. In fact, if you feel like this spiked, comment below or tell me what weird symptom did you have that I haven't talked about yet in this video, because there's many more. In fact, I could keep going. I hear zinging and tingling down the arms, down the legs, and the extremities, hair loss, changes in hair color, texture. So many different things can happen through perimenopause. Now, I want you to know that my new book, The Perimenopause Survival Guide, just hit the Amazon store for pre-orders. It's gonna hit shelves in October 14th. But if you pre-ordered your book, that would really help support me so much because I really want to raise awareness specifically about perimenopause, the decade before menopause, or all the years where you may be having symptoms, but you're still having periods or you're still ovulating. I really, really thank you so much for your support. If you haven't already, like, subscribe, and definitely follow me on my socials. If you would like to be a patient, jointhecollaborative.com is where you're going to want to go. This is the place for elite expert care, and we really believe in this model where we're also bringing in wellness partners. We have experts with understanding in fitness, sexual health, mental health, and more. And we really believe in a holistic, integrative approach to your care. We want you to not just survive, but thrive through your perimenopause and menopause journey. Thank you so much for following along. I'll see you next week for a brand new video. Bye, guys.